We're still waiting for a briefing from President Trump and the White House Coronavirus Task Force. Initially, the media had been complaining about a lack of those very briefings, but now they're almost a daily presence in our lives. But momentum is building to stop airing these briefings. The New York Times with this headline, quote, "Trump's briefings are a ratings hit. Should networks cover them live?" And some in the media say we shouldn't show them at all.
If it were up to me, and it's not, I would stop putting those briefings on live TV. Not out of spite, but because it's misinformation.
All these briefings are substitutes for the rallies. There's no question there. It's his outlet. It's his ability to command the stage. He knows he can dominate the newscast.
There's also Trump using this as a political platform to promote the messages that he is not able to promote at rallies because he can't hold rallies right now.
Here's President Trump clashing with the media.
Just so you understand, are you ready? I think there are certain people that would like it not to open so quickly. I think there are certain people that would like it to do financially poorly because they think that would be very good as far as defeating me at the polls. I think it's very clear that there are people in your profession that write fake news. You do. She does. We've done one hell of a job. Nobody's done the job that we've done. And it's lucky that you have this group here right now for this problem.
Dana, I'm going to go to you first. You worked at the White House. The insanity of this is they don't want the American people to hear from the President of the United States live in the greatest crisis of our lives. That's how nuts this is.
Yeah, I don't really understand how somebody's political analysis of the president's briefing is more important than the president's briefing while he is, basically commanding the ship. And I know that a lot of them don't like it that President Trump is the president, but he is the president, and he is the one that is entrusted in making decisions that have to do with our livelihoods and our health. And the thing that he has done is surround himself with people at those briefings that also take questions. Like, they've never seen anything like this where you could have a briefing that lasts 2.5 hours. I mean, maybe that's part of the frustration for the media. They want to see their own faces on TV. But here's the thing. There's a lot of great places, including here at Fox News, where you can get the full information. If your local station or your local radio decides not to cover it, you got a place to go.
Greg, just talk about the fact that these individuals would rather hear themselves speak than a president providing information to all Americans who care about their health and their loved ones.
Incompetent people fear competition because the competition exposes their own idiocy. For example, this argument should sound familiar to anybody who worked at Fox. Because you're successful, don't air them. That was the same argument when Fox News came up, because if you can't beat them, get rid of them. And that's the whole thing. So Trump gets on the air. We all know that he's a ratings winner. We saw that. That's how CNN and Morning Joe elected him. They put him on their air all the time. And then he became president, and now they're like, how dare he? Well, they should cover him because he happens to be the commander-in-chief during a pandemic. You know what? CNN.com reported on Meghan Markle is forbidding Prince Harry from visiting his father. That's what they're covering.
That's what they're covering.
But the pandemic briefing, forget that.
Juan, you're a lifelong newsman. You can't be in favor of this.
Well, I think he's the president, and so I always think you got to cover what the president has to say. But he's turned this into basically a political rally event. It's the Trump show. So every day he gets this Trump show platform, and he does deliver a lot of misinformation. He's, when he's asked how he's doing perfectly. It's as perfect as the call to the Ukrainian president. When he's asked about Governor Cuomo of New York,
I see what
Cuomo
you did there.
could have bought ventilators a long time ago. Hang on, let me finish.
I see what you did, connecting the impeachment to the virus.
No, hang on a second. Hang on a second, Dagan. Dagan, he said that. I didn't say that. He said it was as perfect as his phone call to the Ukrainians. And he says things like, oh, we've caught up totally with the testing with regard to South Korea, when in fact, we're far behind. South Korea is a much smaller country than we are. I think they've tested like 1 out of every 150 people. We've tested 1 out of every 900, and we're way behind. So he says all these things. People come to these briefings for real information, and instead they're getting a political presentation. And I think that's why a lot of people say, yes, he's the president. You got to make sure the American people have access to what he's saying. But now the question arises, as a journalist, are we supposed to just say, oh, yeah, whatever he says is fine? I don't know about that.
You're the only person left on the earth that takes Trump word for word. What he's trying to do is present optimism and Fauci is the good cop. He's the good cop. Fauci's the bad cop. They both want the same thing. But you're acting like this is 2016 all over again, where when he says something, it's directionally true. Sometimes he gets some little things wrong. But the American public actually understands it. It's only the inside the Beltway journalists who are always wrong on this. And that's why you're always so far behind on the real stories, because you sit there and you just obsess over these things.
I think the real story is that the people want leadership they can trust.
And they're getting it.
I think that's why Dr. Fauci they're not getting it from Trump. They get it from Fauci. They get it from Dr. Birx.
So Trump's doing a terrible job, Juan?
But
He's doing a bad job?
No, Trump's doing a bang-up job of putting on a TV show that gets great ratings.
There you go. You just can't do it, can you, Juan? You can't admit a little bit.
Yeah. Jesse?
What you said he's making mistakes, but you forget. You say, let it go, let it go.
The media worrying about misinformation is like the mafia worrying about crime. Look in the mirror. CNN lied for 2 years. We should take them off the air. Come on. This is what they're worried about. President Trump has turned the media into C-SPAN. That's all they are now. They point a camera and they take live press conferences. And they can't add their analysts and their pundits and reporters to spin it, slice and dice it and edit it and put a little special sauce and serve it to the public. They get stuff raw now. And the American people are in the mood for raw material. And they don't want any more spin. The media thinks that they're smarter than the president. And they have to point out every little time that they think they're smarter and they got him. But that's not true, because the American public trusts the president more than they trust the media. They like him more, and it's because he's more compelling. He's more honest, and he's more straightforward. And that's the truth, because when he goes up there, you're not only getting real face-to-face reality, you're getting a man that's pretty entertaining. And they can speak in solid gold sound bites that every single American can understand. They're jealous of him. They don't have anybody on those networks that can compete with that kind of talent. They don't have it in Hollywood. They don't have it at CNN. They don't have it anywhere. And instead of realizing the deficiency and trying to work on improving their performance, they're trying to censor the President of the United States. How insane is that? If you want to fact check him, Juan, fact check them afterwards when you have the 13 little boxes on the screen like we do right now. Fact check them all day long. But don't cut them off in the middle of a press conference.
Yeah, Dana, go ahead.
I think he's the one that's trying to take our time, Jesse. You say we're jealous of him. I think he's trying to impose himself on the news coverage.
This is the American people's time.
There is no filter.
This
is the American
people's
and you have a
time.
political leader. If you have a political leader who is just like spouting at the American people, you know, at some point you got to wonder, is that propagandistic?
Reporters are asking great questions, and we're getting great answers. And some of the questions are so good, the task force is going back and saying, I hadn't thought about it that way. And then delivering more news about that same question the next day. It's helping the American people.
Okay. Oh, this is what I was going to say, is that when the president tweeted around 5 o'clock that he was going to be around 5:10, and they're going to focus on this question of what are these guidelines going to be that will tell people, state governments, local governments, companies, workers. You can bet people want to tune into that, because they're going to talk about what are the guidelines going to be. How are we going to get people back to work? How are we going to do this responsibly and with sensitivity and maybe with some technology? It's possible that we are going to be able to have this finger prick test soon that would tell people you've had it, maybe you're immune now you can go back to work. There's also going to be the possibility of doing like in South Korea, where you would get your temperature taken before you were allowed into the workplace or into a shop if you were wanting to buy groceries. Like, they're going to provide information that is actually really vital. So I can't imagine people not wanting to take this press conference, this one in particular coming up, because this is the beginning of the president laying out how we're going to get back to work in a responsible way.
These are people who want to shut the president down, who lied about Russia collusion for literally years, and now they're playing doctor on television. That's what they're doing. They learn their medical knowledge from Fletch. That's how smart they are.
I got a lot out of Fletch.
Fletch, that's a throwback.
Yeah. The sequel was better.
President Trump and the coronavirus task force briefing is going to start any moment now, so stay with us. But in the meantime, hospitals in the outbreak's epicenter, which, as you know, is New York City, they're being overwhelmed with COVID-19 patients and cases in the state now top 37,000 people. One hospital in the city, a single hospital, folks, is reporting 13 deaths within 24 hours. Doctors are warning of apocalyptic-type conditions. And healthcare workers now saying they don't have enough protective gear. Some nurses forced to wear trash bags to keep themselves safe. And in Boston, local news outlets reporting more than 100 hospital workers have, in fact, contracted the virus. I think what we're seeing now, Dana, is this thing is, spreading into areas of the country that previously weren't being hit. I noticed particularly in the South, New Orleans, they're saying they are having just a surge of virus confirmations. How do you take that?
Well, I think that it is showing that what Dr. Fauci and Dr. Birx have been telling us for weeks is coming true. Like, we know that the social distancing is having an impact to try to slow the rate of people that need hospitalization. So that's good. One of the reasons to take the president's briefings is, I believe it was just yesterday or the day before, that the president announced he was allowing the major disaster declaration for Louisiana, or the emergency declaration, because that allows some funds to get there for what they're going to need. And different states are going to have different problems. Louisiana, one of the problems was big parties at Mardi Gras. Okay, so we know that that's a highly dense situation. Now, take it up there in Wyoming, where my family's from. Like, this is not there, at least yet, and it's not overwhelming the situation yet, but that governor also ordering stay at home now. So you see this phase coming, and you can also hopefully start to see after this briefing, then what does the other side look like? So I think it all is going according to how the Fauci and Birx have been telling the president from the beginning it was going to go.
And Jesse, what do you think about the hospital workers? The poor people having to go to work. They don't have the proper garb, so they're putting on garbage bags. And now there's the question, do the nurses, the doctors, all of the people who make things happen at the hospital keep going to work, or do they say, hey, we can't handle it?
Oh, I hope they don't stop going to work, because that's the best we have right now, Juan. Governor Cuomo says that they have enough equipment right now for the hospitals. I guess maybe there is a disconnect, because you've obviously seen pictures of people with that type of garb. I spoke to a guy today who's a doctor at Cornell Medical up in New York City. And he says he's confident now. And here's why. He knows how to not get coronavirus. And he's on the front lines. He says one of the biggest mistakes you can make is touching your face. He says if you do everything to avoid touching your face, that is the #1 way to transmit something. You touch someone, you shake their hand, you touch a surface, and you haven't been Purelling, or you're in a small room with someone for 30 to 45 minutes who's infected, and then you touch your face. That is the #1 way that this thing gets transmitted. So you got to stop touching your face, and you have to carry Purell around everywhere, and you have to really watch out what surfaces you're touching. But with that knowledge, everybody can social distance and stay clean, and that's how we're going to get this thing solved eventually.
I just want to...
Hey, Greg, what do you think of...
No, I just want to point.
Sorry.
I just quickly want to point out, one of my friends is working in an emergency room, and they think he actually got double pneumonia from coronavirus like several weeks ago and wasn't diagnosed with it. And these people are putting their lives on the line to save New Yorkers, and they would gladly do it for every single American. Never forget that.
I just want to add before the president comes out, a very important question. Who are the patients that are dying? Were they previously healthy young patients? And did they receive any of the hydroxychloroquine plus the antibiotics? Because I'm interested in knowing, has anybody died from that drug? Because I haven't heard it. All I've heard anecdotally from doctors is that when you get that drug, you get better. So you got to demand that. If you have symptoms, you got to talk to your doctor. We don't know anything about the patients that are succumbing.